Are you someone who is experiencing shoulder pain? I can tell you myself, I have experienced shoulder pain several times too. And most of the time, the first thing, fear comes to your mind that did I turn my rotator cuff? And should I be concerned? Yes, you will be concerned. Only 2% of the time it happened. If it happened because of an accident, then you don't have to really worry. You will be again going to hospital and they're going to do MRI, a CT scan to find out what's going on. Then that's so forth. Then you don't have to worry. 98% of the time you should not have to worry. If that is the turn rotator cuff, you are getting the diagnosis, still you should not be worried. This is not your rotator cuff. What I am going to explain it to you, as an occupational therapist myself for last 30 years, it gave me a lot of insight and understanding how that works. It's not that easy and simple. When we talk about the turn rotator cuff, it's not all about your shoulder. Our shoulder joint is a very complex joint. So just by focusing on shoulder, that we are forgetting what are the other things that are involved. And the turn rotator cuff, what you are getting the diagnosis and the fear you have, is the process got started long time ago on what you are seeing as an action. So I'm going to give you a little bit idea about here what goes on. Why when I am saying shoulder joint, why we should not be concerned about rotator cuff, because in your shoulder joint there is a big part of this thoracic spine right here plays a big role, which over the period of the time our body is changing, so that is going to impact your shoulder joint. Then comes your shoulder blade, which is the key factor. So unless we take care of that, nothing is going to change. Then comes clavicle, your sternum, your rib cage. All this needs to be taken care of. Then only we can have the result to do it correctly. So this is something has to be addressed. So keeping in mind, doing the right thing, you are going to get the result and nothing to be afraid about turn rotator cuff. By doing things, what you need to do, you are going to get better and your shoulder will be better.